Bring out the bestness and the worst.
The low-life scum, what they're willing to do. Griff, by the way, that great American, Summer Dickerson, I got to salute her. She is single-handedly warning her community in Louisville, Kentucky about a scam that's happening that largely is going on all over America. We're talking about people just going door to door, offering a home test for COVID-19. There is no home test for COVID-19. City attorneys from around the country warning on this. FTC saying complaints are way up. And we also know of some scams that are going on right now. Like the latest ones, they come via text, they come social links, your email. One involves a text that has a mandatory online COVID test warning claiming to be from the Health and Human Services Department of the government. That is not legitimate. Don't click it. That right there will take you into trouble and nothing else. Also, another scam. It's called the "You Are Infected" email. Griff, what this does is this ends up simply downloading a payload onto your computer, putting malware on it. This right here, the scam is, hey, click here because we know somebody that you know that was infected and has tested positive. So follow these emergency instructions by downloading the link. Do not download the link. Don't do any of that. And then for small businesses, this is just tragic. You got a lot of people who are desperate for this SBA assistance, and they get emails like this one that say that their application submission is being confirmed, and also to follow this to download that link. Well, what that does is surrenders remote control to hackers to your device. Do you want to click on any of that? No. Here is the advice I have this morning. Be on the lookout. It's tragic that we have to think about watching out right now, but we do. Be on the lookout for these. Don't click a link. Just if you think something's legitimate, whether it's a warning from your bank or if it's somebody soliciting for a charity, don't click the link. Instead, just go there directly on your own. And never wire money or send cash, especially to someone you don't know, as part of any of these sort of email solicitations. And never, even though you're looking at this and you go, wow, this is obviously a scam, don't reply to it. And don't forward it to any of your friends with a warning. That is a trigger that gets it populated even further and also tells the hacker sending it to you that you're a sucker and you're willing to get some more tricks like that. And then keep that software up to date, whether it's security software or the operating software in your phone, et cetera. You want to keep that up to date, and that should help you out.
All right, Kurt the Cyber Guy, thank you. It's a shame we have to tell you about these things, but thanks for coming on and telling us how to avoid them and avoid the scams. Thanks, Kurt.
Happy Easter, Griff.
Same to you, friend. All right, coming up, a UPS driver answering the NYPD's call, delivering nearly
an SOS from the chief of police of the New York Police Department. They need hand sanitizer. Literally, within 2 hours, we had 50-gallon drums on a UPS truck heading up to the NYPD.
The White House praising liquor company Pernod Ricard and UPS for answering the NYPD's plea for help, proving that we're all in this together. The company's making a second delivery of essential supplies to New York's finest this week. And the driver was a former police officer who says he was honored to be of service. He joins me now, UPS driver John McCown. John, thank you so much for being here. So, listen, you're wearing the brown right now of UPS, and you drive across the country, but you've worn the blue as well. You've been a police officer in West Virginia. This is a new mission. Tell us about it.
Well, you know, when this came out, my hub manager asked me if I would be interested in delivering some hand sanitizer to the NYPD. And, of course, I jumped at the chance. My whole career has been about service. As a military veteran and also as a police officer, we serve the ones that needs help all over the country. And what a great opportunity to grab this trailer load, 88 drums of hand sanitizer, and deliver it to the NYPD. You know, we've done 2 shipments already. That's almost 10,000 gallons of hand sanitizer to the New York Police Department.
I mean, from one army to another. I mean, the NYPD is an army in and of itself. UPS, what you guys do, a massive operation. Where did you truck it from? How far was the trip? And let me ask you, what are you thinking about in this moment as you're doing this?
Well, the Trailer came from Little Rock, Arkansas, came into my terminal here in Mechanicsburg, Pennsylvania. I picked it up right away and took off for Flushing, New York. It's a time when we all need to pitch in. I'm just happy that I got a chance. UPS has been in business since 1907. That's 113 years. And when something like this, when they ask UPS to jump in, I know they're at the front of the line, raising their hand, saying, "What can we do? What can we do?"
Yeah.
I was honored
what did the
to
NYPD,
meet the guys, the men and women of the NYPD.
And what did they say to you when you arrived, when you showed up with what they needed?
They're just so appreciative. It's bringing something to them that may very well save their life. This hand sanitizer saved their life, their family's life. So we are pitching in every day. UPS does a big business as far as taking care of the ones that need taken care of, and that's what we do. Absolutely.
John McCowan, thank you for your service in the military, for what you did in West Virginia as a police officer, and what you're doing now, still serving. We're all in this together, as you said. Thank you very much, John. Appreciate it.
Thank you, sir, for having me.
You got it. Thank you. All right, we have information on how you can help, plus more stories of people going to extra lengths to help each other as we deal with this moment. You can find all this at foxnews.com/America Together. Check it out. All right, still ahead. Last week, we introduced you to this incredible Minnesota nurse answering the call to help in hard-hit New York. Well, this morning, we'll check back in with her after a week on the front lines. Wow, amazing.
To Americans ahead of Easter Sunday. The president's remarks come as new data shows stabilization in some of the country's hardest-hit areas.
But the nation is still under threat. In the last 24 hours, more than 2,000 people have died in the U.S. as cases top 500,000. Nearly 19,000 Americans have died in total.
Global deaths now surpassing 100,000 with nearly 2 million cases. More than 300,000 people have recovered worldwide, which is a very important number to keep looking at internationally and here at home. Honored, as always, to be joined by co-hosts Griff Jenkins, Washington, D.C., Jillian, right below me here in Studio F. Awesome to shout at you in between the commercial breaks.
I know.
And chat with you. Griff, I always shout at you. Why not? And Griff, I got to ask you an intro question here. So many people looking to Washington. What will Washington's response be? A lot of it has to do with the town itself, though. How are things there?
Well, things are good. It's certainly one of these places that the doctors, Birch and Fauci, say we've got to watch. But, setting aside the health threat and us being vigilant here, wearing masks, social distancing, you talk about the Washington response area. And, we all, I think by now, are realizing that we are living in a big historical moment, perhaps the biggest historical moment of our lifetime. And Washington's response will be one that is studied, critiqued, applauded, and besmirched for the next decade or more to come. And that's why, look at some of the people we've got coming up. Congressman Devin Nunes, Congressman Brad Winstrup, as well as the pastors, Franklin Graham and Joel Osteen, and the doctors. We've got you covered because the Washington response, just one piece of it. It is, of course, Easter weekend. And, of course, there's a lot of questions still about this deadly virus across the country.
It's not bad. You got the politicians, the pastors, and the pandemic experts. That is the lineup we have all morning long. Jillian, it's quite a show we got.
Yes, it is. That's for sure. And Pete, a minute ago, you were talking about how important it is to keep in mind the recovery numbers here to try and just keep that positive mind focused. And the total U.S. recoveries as of this morning, more than 29,000. So certainly a number that we want to keep our eye on. That's for sure. In the meantime, guys, the president, has been busy talking about what the plan is going to be when the country is ready to reopen, when it's going to happen, how it's going to happen. Take a listen to what he had to say.
I have a task force. I'll have a council. It's going to be announced on Tuesday with names that you have a lot of respect for, a lot of great names, different businesses, different people, bipartisan. I call it the Opening Our Country Task Force or Opening Our Country Council. I'm going to have to make a decision, and I only hope to God that it's the right decision. But I would say without question, it's the biggest decision I've ever had to make. I want to get it open as soon as possible. This country was meant to be open and vibrant and great.
You guys know, though, you just can't open it too soon because then you risk having to go through this all over again. So I think that's the fine line that the president and all the experts are walking right now and trying to figure this out.
Yeah, what I appreciate is the president is laying out in front of us the dynamic we're all feeling, right? You're listening to the experts, the models, many of which have been very wrong, by the way, and a lot of the measures we've taken have helped change that. But we're flattening the curve. But when you look at that side, it's a sense that, man, we got to start moving at some point, and you can target it in a certain way so that certain regions, certain businesses, certain people, younger and healthier, can get out there and drive the economy in ways that if we're not thinking about that, now we're another month out with the economy closed, and the consequences of an economic crash can end up being as bad as what we're seeing on the healthcare side. And that's what the president seems to be talking about here.
Absolutely. And we talked, in the last hour with Brian Brimberg, a business professor at King's College, saying that this task force actually is a critical piece of this. Listen to what he said.
Leadership means getting out ahead of issues. We do not want to be caught flat-footed when we're ready to open the economy. That's what this task force is all about. It's absolutely essential. It doesn't mean that we're going to rush into anything. It doesn't mean that we're just going to throw the doors wide open. But this is a complex issue, as the president has said. You've got to be planning ahead of time, and you've got to get the right people around the table to do it. I am so glad that he is starting this process now.
Yeah, and I had asked him, going off of that, what type of minds he thought would be good for this task force. And he said, look, you have to have a combination of, brilliant economic minds as well as brilliant health minds. And he said, Griff, you asked him if it needs to be bipartisan. And I think that that's one of the key things right now.
I totally agree. Listen, Pete was making the point earlier that, if you get into a partisan fight, it's going to really disrupt things. Brian as well, kind of confirming it. But I do offer that having some sort of bipartisanship so that everyone gets to play a role in the revamping of the economy led by President Trump and this task force is going to be really the key on whether it stumbles out of the gate or whether it takes off like a rocket.
Well, yeah, that's why last hour we talked about this 9/11 style commission that Adam Schiff and Kamala Harris want to launch right now in the middle of this issue. So let's set that aside. Let's figure this out. There'll be plenty of time for postmortems. You want to be political about it? There'll be an election in November. That's fine. You can have that conversation. But right now, the president tweeting yesterday saying small business loans, the fund may run out. The people that are well connected, that have the great lawyers and accountants are accessing the money. What about the people at the back of the line that need to get it? We need to address that. Infrastructure, which could be a way to spend money that get people going. And then Brian Brimberg and others have also talked about a payroll tax holiday. Why are we taking the money when we can leave it with small businesses and ultimately employees, keep people employed for this temporary amount of time? The solutions are there. The question is, will Democrats in Washington, I'm not talking about Cuomo and Gavin Newsom in California and New York, which have shown a willingness to work with the president. Politicians in Washington get past their partisanship to get to what we really need, and then we can have the other conversations later on about, say, the communist Chinese who started this whole thing to begin with.
The focus definitely right now needs to be on getting the money, getting the loans into the hands of the people who really need it. That is, I think, the one thing everybody can agree on at this point. Guys, I want to show you some of these numbers here, some of these percentages, and these are the potential hot spots, a 7-day increase. Take a look at this. You can see Delaware up there with a 221.7% increase in the last 7 days, followed by South Dakota, Maryland, Rhode Island, Pennsylvania on that list as well. There are signs of stabilization in areas like New York and California, but Dr. Deborah Birx warns that, we have not reached the peak yet, warning that these areas could be the potential next hotspots. Let's go ahead and take a listen to what she had to say.
The American public who have really taken all of this to heart and stayed home. I know last week we really asked a lot of people in the Washington and Baltimore area to consolidate, not go out frequently to grocery stores or pharmacies. You can really see that that's having a huge impact. So it's really about the encouraging signs that we see, but as encouraging as they are, we have not reached the peak.
What do you guys think about that?
Well, I want to weigh in here because I think it's really important. You know, here in Washington, and Pete, you often ask me, you know, how things are here, and you go out and it doesn't seem like people are as worried. They see what's happening in New York, but it's not the situation, fortunately, here yet. And that's why the mayor here, Muriel Bowser, is encouraging people to wear masks anytime you go out. I wear one when I go into the grocery store or CVS now, out of the courtesy, because we all are playing a part here, right? I'm protecting you, you're protecting me. If you're sick, you're staying home, but yet it is these other areas, the DMV, DC, Virginia, Maryland, that we're hearing about. We're kind of all tied together, and you see that spike in Maryland, very concerning. The governor there, Larry Hogan, also really urging that we are approaching our peak soon. We don't know when, but when we get there, the more we participate, the more we adhere to these CDC guidelines, the more likely we are to have a lower peak and flatten it smoother. That's been the lessons from the West Coast, and now hopefully the lesson that's coming out of where you guys are in New York.
Yeah, I mean, we've been hearing, based on the models and the experts, about these doomsday peaks. But again, Governor Cuomo talked about the need for 140,000 hospital beds. That's what will be needed at the peak. Instead, there are 18,000. You know, I don't know what, I can't do the quick math on that. I won't even try. But that's 10%, 15% of what they said would be needed at the peak. The Javits Center, which was overhauled to have 2,500 beds, 300 people are there. That's a result of people being responsible where they are, listening to guidelines, but also just because we're seeing peaks doesn't mean we need to see shutdowns across the country. And I think that's what the president is channeling. If you want to get the economy back going, you understand the prudent measures we're taking, you listen to the doctors, but at the same time, that second task force is, I think, at the front of people's minds right now. They've lived in the healthcare side of things. Now, how do we live in both worlds where we restart responsibly?
Look, it seems like the next few weeks are going to be critical. I mean, I know that it also seems like we've been saying that for a couple weeks at a time right now, but you heard last week the warning that this week that we just experienced was going to be one of the worst, and next week could be equally as bad. You know, some doctors are saying that.
But it hasn't been as worst as they've been telling us it's going to be.
But that's a good thing.
And that's a great thing.
That is a great thing. I mean, I'd rather that than the worst case scenario, absolutely, because the more lives we can save at this point. But the point I'm making is we are still not out of the woods yet. We still need to social distance. We still need to, you know, play our part in all of this. I know it's hard. I know people get frustrated. You know, it's Easter this weekend. I know people want to get out, but it is so critical right now in the next few weeks, in the next week, you know, taking it day by day to just continue on this course.
Yeah, I mean, I can't top that. Look, we got a stable full of prize racehorses ready to just burn up the track. We just can't let them out till the weather gets a little better.
Absolutely. All right, let's take a look at some of your headlines right now, starting with this. Stimulus checks hitting the bank accounts of some Americans overnight. A Treasury official telling Fox News the first round of payments will go to Americans who filed taxes electronically in 2018 or 2019 and received a refund through direct deposit. Those who didn't file electronically or at all can get their check faster by entering their bank information on the IRS website. The majority of eligible Americans will receive their payments no later than Wednesday. Some good news there. The White House and Congress working together on a new coronavirus relief bill. Treasury Secretary Steve Mnuchin speaking to Senate Minority Leader Chuck Schumer on Friday, agreeing to replenish a $350 billion paycheck protection program for businesses. The Trump administration and Congress hope to act on the measure next week. British Prime Minister Boris Johnson now able to go for short walks as his condition improves at a London hospital. He was transferred to a ward from the ICU after being hospitalized for COVID-19. Johnson's father telling the BBC that the Prime Minister isn't out of the woods yet and must rest up before returning to lead the country. But certainly a step in the right direction there. A FedEx worker goes the extra mile for an 11-year-old girl with an autoimmune disorder. Watch as the driver sees a note about the girl's condition on the front of her Florida home. The driver then goes back to his truck to get disinfecting wipes to clean the package. He wrote on the box informing the family that he had cleaned the package after seeing the note. That's fantastic. For more inspiring stories like this, you can head to foxnews.com/America Together. Love that.
Great story.
Yes,
Great
it is.
story.
Neat. All right, coming up, a mission of faith. Meet the New Yorkers behind the 6-man COVID-19 emergency.
Good friend of mine that works for the Chainsmokers through Sony Records called me up and said that this guy Adam in New York City that owns Sauce Pizza on 12th Street wants to help, and he wants to provide pizza to all the doctors and nurses. So we met him 3 weeks ago. We started with our first run at NYU Langone. We call it Ken Langone's office, and we're right now up to 6,000 pizzas, 40 hospitals, Javits Center, NYPD, Fire Department, and every day we're out there, thanks to Adam, who owns Sauce Pizza, to donate, thousands of pizzas for the first responders.
Well, Vincent, no better fuel than pizza, no doubt. Now, your background at 9/11, White House advance, I mean, you understand logistics. How are you organizing this to be efficient? How are you determining where to go next, what people need?
So what I've done, thanks to my background, my dad worked in the NYPD, Brooklyn DA's office for 45 years. My brother's a colonel in the Army. So thanks to my dad and my brother, they've taught me just how to get things done. So early on, I reached out to all of my contacts that I have through the NYPD, the Fire Department, New York City OEM, State OEM, FEMA, and I directly, found out that a lot of the PPE, the mask, and a lot of the logistics that they needed, they just weren't getting there. And I have to say, the president and the governor, the mayor, they've all done a good job. I'm not here to blame anybody. I wanted to make sure that I could use my asset and my research, and thanks to the Catholic Church, just to help to get things done. So what I started to do is I started to find basically container ships coming in from the Port of Liberty that were going to warehouses in New Jersey. And I called people that I've known for years and said, all right, can we call that vendor and can I come down with trucks and basically pick up the supplies?
So you're almost...
What I would do is I would call the U.S. Customs, Chief Sanko, who's done an amazing job to help me to clear these critical supplies. I would literally meet the truck as it entered a warehouse, and as that warehouse was opening up the truck, we would unload those supplies and bring them right into New York City.
So it's almost like you're filling in the gap.
Dealing with Catholic Charities, the NYPD, the FDNY, every contact I had, I basically said, what do you need? And let us help. And thankfully, because I work for the Catholic Church, I'm not dealing with the bureaucracy and the red tape. I'm just getting it done. I mean, thanks to Monsignor Harrington and the bishop, they've given me the ability to say, Vin, just, help the people in need. And if there's any issues you need, let us know. So I think that because of my skill and because of my background, and I have to say my team is working 7 days a week. We've responded to basically every single hospital, almost every single precinct, every single firehouse, the Javits Center, New York City OEM, State OEM. I've called a good friend of mine, Jimmy Quint, donated the Dunkin' Donuts truck to New York City OEM. Birch Coffee.
The grocery app there seeing record downloads during the COVID-19 pandemic. The retail giant grabbing the #1 spot across all shopping apps in the U.S., even surpassing Amazon by 20%. Jillian?
Thanks, Griff. Last week, New York Governor Andrew Cuomo asked licensed healthcare workers around the United States to help support New York facilities that are desperately in need. One doctor from Denver is now answering the call and moving to New York for a month to work at a field hospital in Brooklyn. Joining us now is emergency medical physician Dr. Camilla Sasson. Doctor, wow, incredible. Thank you for joining us.
Thank you for having me.
Why did you make this decision?
I was one of the 2 emergency department docs that was on the night of the Aurora shooting many years ago here in Denver. And I remember at about 2 o'clock in the morning, out of the woodworks came all of these other physicians and techs and nurses and support that we had never called. It was the most amazing feeling myself when I was overwhelmed with all the patients that we were seeing that night. And so I think I just want to give it, pay it forward really at this point and do the same for New York.
What did your family and friends say when you said that you were packing up to go to New York and help, where, we are seeing so many cases in New York City in this country?
Yeah, so I've had about a lot of interventions in the last week saying, what are you doing? What are you thinking? You can make an impact here in Denver. Why are you going to the epicenter of the COVID battle right now? And, I think to me, it's where they need me. We've done a really good job here in Colorado. Our surges are not as high as we were expecting. And so, if there's people that need to be taken care of, if I've got colleagues that need help, I want to be there.
Are you afraid?
I'm afraid, I'm anxious, I'm a little bit terrified, but at the end of the day, this is, what I signed up to do is to help people. And if people need help, I'm going to go and help them.
Absolutely. Do you know anyone out here?
Not really, no. So all I know is it's a little chaotic. I'm leaving tomorrow. I was supposed to leave on Monday, but I'm leaving tomorrow now. And I'm going to show up at my hotel and they'll tell me what I'm going to do, and anywhere from 4 to 7 days a week for 12-hour shifts.
Wow.
That's about all the information I know.
What are your expectations, though, for what you're going to be doing and the situation you're going to be in once you get out here, the types of cases, the types of illness that you're going to see?
I think I've been an emergency medicine physician for 17 years. I did talk to one friend who is out there right now, and she told me this is like nothing she's ever seen before. And we've both worked in really busy trauma centers and really busy, urban areas. And so I don't know what to expect. I'm going to keep a little video log to keep everyone up to date so that they know I'm okay, and also kind of some of the things that we're doing out there. But, at the end of the day, I'm hopeful that all of the things that you guys have been doing in New York City are really going to make an impact, and hopefully those numbers are going to start declining soon. And so hopefully I can just go help.
Well, that is certainly the expectation. That is the hope for sure for everybody in America, everyone across this country. Dr. Camilla Sasson, thank you for what you're doing. Thanks for joining us, and keep us updated, okay?
Absolutely. Thank you.
And stay safe. And as more doctors and nurses answer the call to help New York, Governor Andrew Cuomo is calling on the federal government to repay those on the front lines.
After 9/11, Congress created a victims' compensation fund. I've been working with our congressional delegation. We think the federal government should set up a heroes' compensation fund to compensate our health care and other frontline workers for what they did here. Saying thanks is nice. Actually providing assistance is even better.
Here to react, retired Marine Corps bomb tech and Fox News contributor Joey Jones. Joey, thank you for being here this morning. I'll see you tonight on Gutfeld as well. Joey, to this point though, what do they mean by a fund? Is this, in the military, if we were overseas, there was hazard pay. Are we talking about plussing up people who are going above and beyond? Is this a litigation fund? What are we looking at here?
Yeah, you'd really have to ask Governor Cuomo exactly what he means by that, although in theory I think this is a good idea. I think most importantly, though, we should look at paying the people that are working right now. I have a lot of nurses on social media that come through and say they're not receiving hazardous duty pay, they're not receiving overtime pay, and I think those are important things. Absolutely, we should take care of the people that are on the front lines working. I was on the front lines one time and I get a pension for the rest of my life because I lost my legs. If someone has respiratory disorder for the rest of their life, they absolutely should get some sort of, if it's not medical care, free medical care, then some sort of stipend. I personally would lobby for a tax cut. That's one thing I think all disabled veterans should get that they don't get, some sort of tax benefit. But if not that, something along the lines of a compensation fund, just to make sure that any type of physical injury they incurred that lasts for the rest of their life, especially if it's respiratory, it could take them out of their job. And I think compensation should be available. One last thing I'll say, the governor kind of forgot the idea that maybe the states should do this as well. And I think there's a debt owed by the individual states, not just the federal government.
Absolutely, Joey. It gets to, also, I want to get your take on something else, though. There's a New York Times op-ed. There's a headline that came out that will probably get your ire, as it did many of ours. It said, the ideas that won't survive the coronavirus. COVID-19 is killing off the myth that we are the greatest country on earth. I haven't just seen this in the New York Times. You see it at Politico, other places, trying to use this moment to say, America's not all that great.
I live in a rural area, and about once a year when it's time for the crops to be fertilized, there's a smell that fills the air. And I know you're not supposed to call names on live TV, but that's about what this guy is. To come into an opinion editorial and talk about how horrible we are in the middle of this pandemic, while people are dying, and even just as importantly, people are sacrificing, putting themselves in harm's way. That's what this country is. And to say that somehow we deserve it almost because we have people in prison, listen, being isolated for 10 months in Iraq and 6 months in Afghanistan didn't make me sit there and go, man, I bet this is what people in prison feel like. No. Not at all, because I didn't do anything negative to get myself there. And so just the idea that somehow this means our country is bad because we have wealth here and because we have capitalism and opportunity to climb the ladder I was born in a 1960 single wide. I watched both my parents fall through the floor. I know what poverty is, and I know this is the place you can get out of it. And to say that those problems that exist everywhere are somehow acute to us, it's disingenuous, and it's full circle, because he says in his op-ed he's spoiled and sitting there enjoying isolation, and then somehow the rest of us should feel guilty about it.
Joey, what makes you proud right now of our country?
The frontline workers we were just talking about. You know, the people that are willing to sacrifice, not because they're going to get a medal or recognition or a heroes compensation fund, but because that's what it takes for others to live. And that is a key. That is a theme in this country that goes beyond ethnicity or religion or place of origin or any of that. If you're an American, which means you're a citizen and you believe in what happens here, then you're a part of something bigger than yourself and you're willing to sacrifice for it. And right now we have 330 million Americans falling in line and doing what they can to help those around them, even if it just means sitting at home. And for some people, this was going to be a bumper crop year, and now it's going to be a bankruptcy year. They're looking at that saying, I hope people live. I hope mom and pop, and I hope I can say that on TV now, make it through this. And for some of the divisiveness coming out of different places, but the mainstream media, I just don't understand it. I truly don't.
All right, Joey. Well, thank you for your service. A hero is what someone does in a blink of an instant, and you did the right thing, as opposed to writing an op-ed in the New York Times blasting America's sacrifice and resolve.
Absolutely.
Thank you.
Joey Jones, thank you very much.
Take care, guys.
Bye,
Happy
Joey.
Easter.
Happy Easter indeed. All right, turning now to your headlines. A boy from a remote tribe in the Amazon has died from COVID-19. The Brazilian government announcing the 15-year-old from the Yanomami tribe was the third indigenous person to die from the virus in Brazil. Authorities believe the virus is being spread by illegal miners entering the region. And South Korea will start tracking people who violate stay-at-home orders. The government will soon require electronic tracking wristbands for anyone who violates the quarantine. This comes after more than 160 people broke stay-at-home orders. But since it isn't law, violators can refuse to wear the device. The plan will be rolled out in the next 2 weeks. And the Trump administration giving the green light for drive-through gun sales. Licensed gun stores can now sell firearms through a drive-through window or their parking lots. It's part of the effort to enforce social distancing. Stores still have to fill out the necessary paperwork and complete background checks. Sounds good to me. And the XFL is suspending operations and laying off nearly all its staff. The moves come after the Football League cut its inaugural season short last month because of the coronavirus. At this point, the league has no plans to return next year. And those are your headlines. That's a case of just bad timing.
Yeah, I saw that yesterday.
I hate to see that. I hate to see that. Washington's team was so good, too.
They were good. I know.
They were good. So much for that. But time now to pass it over to Rick Reichmuth, who I know is disappointed. The XFL is RIP.
Hi, Rick.
Yeah, I tell you what, there's going to be so many disappointed people across so many areas, unfortunately, right now. One of them right now is weather. I tell you what, people thinking we had a pretty mild winter across the east, and now winter kind of is coming in. We got some snow across parts of upstate New York. We have a big storm coming in across parts of the far northern plains. Let me show you the maps here. We got some snow this morning across parts of Montana into Wyoming. That's going to spread across parts of the northern plains. Winter storm warnings in effect. But this week we had incredible rain across parts of Southern California. You see that little rotation in Southern California and in towards Arizona. That system is finally beginning to pull off towards the east, but it dropped over 7 inches of rain across parts of Southern California. What usually some areas will see in an entire year, they got this week. So a little too much too fast, but they'll take that moisture when you can get it. Now that storm pulls off towards the east, and today we've got a threat for some severe weather across parts of Texas. Watch it. We'll definitely see some large hail and some strong winds and a few tornadoes. But tomorrow is the main event here. And that where you see that red is the bullseye for some really large, long-lasting, destructive tornadoes. And this is for Easter Sunday. So people thinking, please be watching for this very carefully, because we're going to be watching the threat for some deadly tornadoes here, unfortunately, for your Easter Sunday. All right, guys, we'll send it back to you.
Busy few days.
Very much so. Rick, thank you very much.
Thanks, Rick.
Guys, I'm still a little hung up on the XFL. They did a lot of things right, though. They put microphones on players, officials. They had access on the sidelines. The first sports league that responsibly opens up, whether it's Major League Baseball, the NBA, finds a way to do it, could be innovative. Get rid of the ump. Listen, I love umps, but get rid of the ump, let it be electronic, maybe 7-inning games, maybe 81 games. Do it in certain places. It would be a national phenomenon. I would even watch like the Dodgers play the Diamondbacks. There's nothing to watch right now. You can do it.
Bring out the bestness and the worst.
The low-life scum, what they're willing to do. Griff, by the way, that great American, Summer Dickerson, I got to salute her. She is single-handedly warning her community in Louisville, Kentucky about a scam that's happening that largely is going on all over America. We're talking about people just going door to door, offering a home test for COVID-19. There is no home test for COVID-19. City attorneys from around the country warning on this. FTC saying complaints are way up. And we also know of some scams that are going on right now. Like the latest ones, they come via text, they come social links, your email. One involves a text that has a mandatory online COVID test warning claiming to be from the Health and Human Services Department of the government. That is not legitimate. Don't click it. That right there will take you into trouble and nothing else. Also, another scam. It's called the "You Are Infected" email. Griff, what this does is this ends up simply downloading a payload onto your computer, putting malware on it. This right here, the scam is, hey, click here because we know somebody that you know that was infected and has tested positive. So follow these emergency instructions by downloading the link. Do not download the link. Don't do any of that. And then for small businesses, this is just tragic. You got a lot of people who are desperate for this SBA assistance, and they get emails like this one that say that their application submission is being confirmed, and also to follow this to download that link. Well, what that does is surrenders remote control to hackers to your device. Do you want to click on any of that? No. Here is the advice I have this morning. Be on the lookout. It's tragic that we have to think about watching out right now, but we do. Be on the lookout for these. Don't click a link. Just if you think something's legitimate, whether it's a warning from your bank or if it's somebody soliciting for a charity, don't click the link. Instead, just go there directly on your own, and never wire money or send cash, especially to someone you don't know, as part of any of these sort of email solicitations. And never, even though you're looking at this and you go, wow, this is obviously a scam, don't reply to it. And don't forward it to any of your friends with a warning. That is a trigger that gets it populated even further, and also tells the hacker sending it to you that you're a sucker and you're willing to get some more tricks like that. And then keep that software up to date, whether it's security software or the operating software in your phone, etc. You want to keep that up to date, and that should help you out.
All right, Kurt the Cyber Guy, thank you. It's a shame we have to tell you about these things, but thanks for coming on and telling us how to avoid them and avoid the scams. Thanks, Kurt.
Happy Easter, Griff.
Same to you, friend. All right, coming up, a UPS driver answering the NYPD's call, delivering nearly
SOS from the chief of police of the New York Police Department. They need hand sanitizer. Literally, within 2 hours, we had 50-gallon drums on a UPS truck heading up to the NYPD.
The White House praising liquor company Pernod Ricard and UPS for answering the NYPD's plea for help, proving that we're all in this together. The company's making a second delivery of essential supplies to New York's finest this week, and the driver was a